There have been 3 reported cases of typhoid fever in the Western Cape, and it has everyone asking, what is typhoid fever and should we be worried? I'm joined in studio by our resident doctor, Dr. Darren Green, and he's going to answer these questions for us. Hello.
Great. Hello.
What is typhoid fever?
Sounds quite dramatic.
It sounds
isn't
very scary.
Yeah, basically it's a bacteria, and the actual name is Salmonella. Everyone knows the term Salmonella,
Yes.
and one of the subspecies, we use the collective term as Salmonella typhi. And typhoid fever is caused by an infection with this bacteria specifically, which is associated with a specific clinical syndrome. Now that syndrome involves things like fever, a lot of gastrointestinal symptoms. So it could look like your regular gastro outbreak. So fever, certainly in a stepwise approach that gets worse and progressive, with associated nausea, vomiting, abdominal cramps, and then associated with those GIT effects, obviously a skin rash, which is a red maculopapular rash. Yes, so those are raised little raised pimples, of fine red raised plaques of skin lesions that you would find with the associated features, as I've mentioned already.
So when you describe it to me, it sounds kind of just like the flu or any other kind of feverish
Well,
sickness.
like a gastroenteritis that people get with a runny tummy, and a bit of fever and so forth, and abdominal symptoms like cramps, etc. But what's interesting about it is the fact that obviously it's spread by contaminated water, so is other bacterial, enteritis, and often contaminated drinking water as the source. So the fecal-oral route, which sounds really gross, is actually where it comes from. So people that are infected with the organism, until they're treated and treated properly, they actually shed the organism in their feces. And if you can imagine, with leaking sewage systems and contaminated drinking water, you could cause quite a endemic breakout.
Can this typhoid fever, can this lead to death? I've heard some people asking this question if there's an outbreak. People are afraid that there's going to be an outbreak, I think, because we don't usually hear about typhoid fever.
Yeah,
Can
so
it lead
people
to death?
often die of the complications of systemic infection. So bacterial infections, where if you allow any bacteria to multiply at astronomical amounts, exponential amounts, it can take over your bloodstream, use up all your good white soldier cells, keep them busy, and leave the rest of your body exposed to opportunistic infections, and certainly complications of what we call septicemia, and that could lead to death, certainly. Dehydration, however, is a big one. You must imagine, if you're nauseous, you're vomiting, and you've got diarrhea constantly, you don't want to eat, you can't hold anything but down, you're not drinking fluids, you fall behind on fluids, you're not producing urine, your fluid requirements are not being met for all normal functions in the different body systems. You're going to then develop the effects and complications of that, where the kidneys start becoming dried out like raisins, and then have damage that can sometimes even become irreversible. So the pH changes, the acid levels in the blood will change with a lack of fluid, with dehydration, and then the different organ systems can begin to shut down, as happens with dehydration.
Should we be worried about typhoid fever?
Yes, we should. We should be able to recognize the symptoms early, report it, and if you find that you've got diarrhea with fever and a skin rash, certainly you can be tested for it. They can do a lab test or a blood culture, and then certainly a simple antibiotic is used to treat it. We use things like ciprofloxacillin as well as ceftriaxone, which are used for periods depending on whether you've got resistant typhoid or not, from 7 days up to a 14-day period. And you need to complete the course, obviously, to combat and to kill the bacteria itself.